Bismillahirrahmanirrahim. Assalamu alaikum. Today we will discuss the sole of foot, part 1. Now actually I have divided this topic into two parts. In the first part we will discuss the sole of foot, and in the second part we will discuss the nerves and vessels of foot. So today we are going to study the sole of foot. The foot is the part of the lower limb below the leg. It has two aspects, the superior aspect which is called as dorsum of foot, and the inferior aspect which is called as sole of foot or the plantar aspect of foot. The learning objectives of today's lecture are: at the end you should be able to describe the architecture of sole of foot, enumerate the layers of sole of foot, and discuss the muscles which are present in the sole of foot. So when we will look at the sole of foot, we will first look for the skin. The skin of the sole of foot is thick and hairless, which is firmly bound to underlying deep fascia by fibrous bands. Now this skin shows flexor creases at site of movement. Large number of sweat glands are present in the skin of foot. Beneath the skin, there is the presence of subcutaneous tissue which is more fibrous that anchors the skin to the underlying deep fascia. Next to this subcutaneous tissue, there is the presence of deep fascia which is also called as plantar aponeurosis. The deep fascia of the sole of foot is The deep fascia, which is also called as plantar aponeurosis, is a thick band of deep fascia. Now this whole dark colored is the deep fascia which is called as plantar aponeurosis. This is the thick band which is attached posteriorly to the calcaneus, and it extends forward as a thick band of longitudinally arranged connective tissue fibers. The fibers diverge as they pass anteriorly and form the digital bends. These digital bends, along with the transverse fibers, help to take part in the formation of superficial transverse metatarsal ligaments. So these digital bends form superficial transverse metatarsal ligaments. Now the muscles of foot. The muscles acting on the foot can be divided into two groups, the extrinsic muscles and the intrinsic muscles. The extrinsic muscles arises from the compartments of the leg, but they act on the foot. They are mainly responsible for actions such as eversion, inversion, plantar flexion and dorsiflexion of the foot. The second group of muscles are the intrinsic muscles, which are the muscles of the foot itself. These muscles arises from the foot and inserts onto the foot, and they are responsible for the fine motor actions of the foot, for example, movement of individual digits. Now the muscles of sole of foot. The muscles in the sole of the foot are organized into 4 layers, from superficial to deep or from plantar to dorsal aspect. These layers are first, second, third and fourth layer. Now first layer. 3 muscles are present in the first layer. Superficial, this layer is the superficial of the 4 layers and is present immediately deep to the plantar aponeurosis. Plantar aponeurosis is the deep fascia. Just beneath the plantar aponeurosis, there is the presence of first layer of sole of foot, in which there is the presence of 3 muscles. From medial to lateral, these muscles are abductor hallucis, Flexor Digitorum brevis and Abductor Digiti minimi. So first and the most important is you have to remember the muscles, the names of the muscles which are present in the individual layer. So in the first layer, three muscles are present. From medial to lateral, these muscles are abductor hallucis. The second is, the middle one is flexor digitorum brevis, and the third is abductor digiti minimi. So the first is abductor hallucis. This muscle is located on the medial side of the sole. This is abductor hallucis. It is present on the medial side of the sole, where it contributes to a small soft tissue bulge. Now this muscle arises from the medial tubercle. This is calcaneum. So this muscle arises from the medial tubercle of the calcaneus, flexor retinaculum and the plantar aponeurosis, and it is inserted on the medial base of the proximal phalanx of the great toe and on medial sesamoid bone. Now look at the muscle. It originates from the medial surface of the calcaneum as well as from the plantar aponeurosis and flexor retinaculum. It is inserted on the medial side. First you have to remember that it is inserted on the medial side at the base of the proximal phalanx of the great toe and on the sesamoid bone. It is inserted on the medial side of the base of proximal phalanx of great toe and on the sesamoid bone. As the name indicates, abductor hallucis, present on the side of great toe. So it abducts, it flexes the great toe, and it is innervated by the medial plantar nerve. This is the muscle of the medial side, so it is innervated by medial plantar nerve. The second muscle of the first layer is flexor digitorum brevis. This muscle, this is the flexor digitorum brevis. It is located in the center of the sole, sandwiched between the plantar aponeurosis and the tendon of the flexor digitorum longus. Now the attachment of the muscle. This muscle arises from the medial tubercle of the calcaneus. This is the medial tubercle of the calcaneus. So it arises from the medial tubercle of the calcaneus and the plantar aponeurosis, and it is inserted on the middle phalanges of the lateral 4 digits. It is inserted over here at the middle phalanges of the lateral 4 fingers. So the first muscle is inserted on the medial side of the base of proximal phalanx. The second muscle, that is flexor digitorum brevis, is inserted on the middle phalanges of the lateral 4 digits. Abductor hallucis inserted on the proximal phalanx of the great toe. The middle one, flexor digitorum brevis, is inserted on the middle phalanges of the lateral 4 digits. Now look at the picture. This is the first muscle, abductor hallucis, which is inserted on the proximal phalanx. This is the second muscle, the flexor digitorum brevis, which is inserted on the middle phalanx of the lateral 4 fingers. The action of this muscle is that it flexes the lateral four digits at the proximal interphalangeal joints. It is again innervated by medial plantar nerve. The third muscle is abductor digiti minimi. This is the abductor digiti minimi, which is located on the lateral side of the foot. Now this muscle arises from the medial and lateral tubercle of the calcaneus and the plantar aponeurosis. This muscle arises from medial and lateral tubercles of the calcaneus. This is calcaneus. It arises from medial tubercle. This part arises from medial tubercle, and this part arises from lateral tubercle of the calcaneus as well as from the plantar aponeurosis. And this muscle again inserted on the base of the proximal phalanx of the fifth digit. Clear? Now there are three muscles in the first layer of sole of foot. This is the first point which you have to remember. The second is from medial to lateral. These muscles are abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. Okay, let's revise the attachment of these muscles. The first is abductor hallucis, which is present on the medial side. So it arises from the medial tubercle of the calcaneus, from the flexor retinaculum and plantar aponeurosis, and it is present on the medial side, so it is inserted on the medial side of the great toe on the proximal phalanx. The second muscle which is present in the middle, in the center, is flexor digitorum brevis. This muscle again arises from the medial tubercle, and it is inserted on the middle phalanx of the lateral four digits. It is inserted on the middle phalanx of the lateral four digits. The third is abductor digiti minimi. As the name indicates, it is present on the lateral side of the foot. This arises from the lateral tubercle as well as some part arises from the medial tubercle. And this muscle is inserted on the lateral side of the little toe. It is the lateral muscle, so it is inserted on the lateral side of the fifth digit, but again on the proximal phalanx. The medial one is inserted on the medial side of the great toe on the proximal phalanx. The lateral muscle inserted on the lateral side of the fifth digit on the proximal phalanx. The middle one is inserted on the middle phalanx of the lateral four fingers. Now the muscles, the two muscles which are present on the medial side, that is abductor hallucis and flexor digitorum brevis, are supplied by the medial plantar nerve, whereas the abductor digiti minimi is supplied by lateral plantar nerve, and as the name indicates, it abducts and flexes the fifth digit. Now come to the second layer. Second layer contains two muscles. The one is quadratus plantae and the second are lumbricals. In addition to the presence of these two muscles, the tendon of flexor digitorum longus, which is the extrinsic muscle of the foot, passes through this layer. Flexor digitorum longus is basically the extrinsic muscle, means the muscle which arises from the compartment of the leg, but it is inserted in the foot, but again it passes through the second layer of foot. So in the second layer, two muscles are present. The one is quadratus plantae and the second are lumbricals. Then third structure which passes through this layer is the presence of tendon of Flexor Digitorum longus. This tendon has a significance in the second layer because the two muscles of the second layer insert or arise from this tendon. So the first muscle is the quadratus plantae. Look at this muscle, the quadratus plantae. This whole is the quadratus plantae muscle, which is flat quadrangular muscle with two heads of origin. The medial head arises from the medial plantar surface of calcaneus. This is medial head which arises from the medial plantar surface of calcaneus, and this is lateral head which arises from the lateral plantar surface of calcaneus. Both these two heads insert into the tendon of flexor digitorum longus. This is the tendon of flexor digitorum longus. The attachment of both these two muscles, that is quadratus plantae and the lumbricals, is in relation with this tendon. This quadratus plantae arises from the calcaneus but inserts on the tendon of the flexor digitorum longus. So this muscle has two heads. The medial head arises from the medial plantar surface of calcaneus and lateral head arises from lateral plantar surface of calcaneus. Look at the picture. Both these heads insert onto the tendon of the flexor digitorum longus. And this muscle assists flexor digitorum longus in flexing the lateral 4 digits. It is innervated by lateral plantar nerve. The second muscle of this group are the lumbricals. There are 4 lumbrical muscles in the foot. 1, 2, 3, 4. They are located medial to their respective tendon of the flexor digitorum longus. Simply, you have to remember that there are 4 lumbricals. 1, 2, 3, 4. There are 4 lumbricals. All these 4 lumbricals arises from the tendon of the flexor digitorum longus. Which muscle inserts on the tendon of flexor digitorum longus? Quadratus plantae. And the quadratus plantae insert in this tendon, and these lumbricals arises from this tendon. So there are 4 lumbricals which arises from the tendons of the flexor digitorum longus. Each lumbrical arises from the medial side of this respective tendon. This is first lumbrical arises from the medial side of this tendon. Second lumbrical arises from the medial side of this tendon. In the same way, this is third lumbrical, this is fourth lumbrical. Now look at this. They are located, the lumbricals are located medial to their respective tendon of the flexor digitorum longus. So we can say they arises from the tendons of flexor digitorum longus on the medial side of the respective tendon, and they insert on the extensor hoods of lateral 4 digits. These are the extensor hoods of lateral 4 digits. So these muscles, look at the picture, these muscles insert on the extensor hood of the lateral 4 digits. This muscle flexes the proximal phalanges and extends the middle and distal phalanges of lateral 4 digits. The most medial lumbrical is innervated by medial plantar nerve. The remaining 3 are innervated by the lateral plantar nerve. Now come to the third layer. The third layer contains 3 muscles. The 2 muscles, that is flexor hallucis brevis and adductor hallucis, are associated with the great toe. Look at the picture. This is the first muscle, flexor hallucis brevis. It is is associated with this great toe. The second is adductor hallucis. This is adductor hallucis, which is again associated with the great toe. The third is flexor digitivity, which is associated with the little toe. So there are three muscles in the third layer. One is flexor hallucis brevis. The second is adductor hallucis. Both these hallucis muscles are associated with great toe. They mainly insert on the great toe. The third is flexor digitivity. This one. This flexor digitivity is associated with the little toe because it is inserted on the little toe. So the first muscle is flexor hallucis brevis. This hole is the flexor hallucis brevis. It originates from two places on the sole of the foot. This is the lateral head and this one is the medial head. The lateral head arises from the cuboid and cuneiform, whereas the medial head arises from the tendon of tibialis posterior muscle. Look at the picture. This is the tendon of tibialis posterior muscle. This hole is the tendon of tibialis posterior muscle. So the medial head arises from the tendon of tibialis posterior muscle, whereas this lateral head arises from the cuboid and cuneiform bones. Both these heads insert on the base of the proximal phalanx of the great toe. Look at the picture. This one and this one. Both the heads insert on the base of the proximal phalanx of the great toe. Medial head on the medial side of the proximal phalanx of great toe. Lateral head on the lateral side of the proximal phalanx of great toe. But you have to remember that both the heads insert on the proximal phalanx of the great toe. Medial one on the medial side, lateral one on the lateral side of the proximal phalanx of great toe. Now this muscle flexes the proximal phalanx of the great toe because it inserts on the proximal phalanx of the great toe. Innervation is simply by medial plantar nerve because it is present on the medial side of the foot. The second muscle is adductor hallucis, which is located lateral to the flexor hallucis brevis. Now this muscle again consists of two heads. This is oblique head and this is transverse head. The oblique head originates from the base of second, third and fourth metatarsals. This is the oblique head which originates from the base of this third, fourth and fifth metatarsal. Whereas the transverse head originates from the plantar ligament. This is the plantar ligament. This one is the plantar ligament. Now look at the picture. The transverse head originates from the plantar ligament. Both these heads insert on the lateral base of the proximal phalanx of great toe. On the lateral side of the great toe, flexor hallucis brevis inserts as well as this adductor hallucis muscle insert on the lateral side of the proximal phalanx of great toe. Clear? The first muscle is this is the first muscle, which is flexor hallucis brevis. The second, this is the first muscle, which is flexor hallucis brevis. This is the second muscle, adductor hallucis. The adductor hallucis has a transverse head and oblique head. This is the oblique head which arises from the base of third, fourth and fifth metatarsal, and the transverse head which arises from the plantar ligament. This is the plantar ligament. Both these heads insert on the proximal phalanx of the great toe on the lateral side. Now look at this picture. This is the plantar ligament we have discussed earlier, and this is the first muscle, Flexor Hallucis, with two heads. The one head we have discussed that it arises, the medial head arises from tendon of tibialis posterior muscle. The lateral head arises from cuboid and cuneiform. Inserts on the proximal phalanx of the great toe, one on the medial side and the second head on the lateral side, but both the head insert on the proximal phalanx. This is the second muscle, which is adductor hallucis. This is adductor hallucis. This is the oblique head of adductor hallucis, which arises from second, third and fourth metatarsals. And this transverse head arises from this plantar ligament. This one is the plantar ligament. And both these heads insert on the lateral side of the proximal phalanx of great toe. They are inserting on the great toe, so the main function is it adducts the great toe, and this muscle assists in forming the transverse arch of the foot. This muscle is innervated by lateral plantar nerve. The third muscle of this layer is Flexor Digitivity, which is located, this is Flexor Digitivity, which is located on the lateral side of the foot underneath the metatarsal of rigid toe. It arises from the base of fifth metatarsal. This middle one muscle arises from the base of second, third and fourth metatarsal. Clear? So this Flexor Digitivity arises from the base of fifth metatarsal, and it is inserted on the base of the proximal phalanx of the fifth digit on the lateral side. Clear? So this is Flexor Digitivity, means it is present on the lateral side, arises from the base of fifth metatarsal, inserted on the little toe or the proximal phalanx of the little toe. It flexes the proximal phalanx of the fifth digit and on the lateral side, so it is innervated by lateral plantar nerve. Now come to the fourth layer. There are two muscles which are present in the deepest layer in the sole of foot, the dorsal intrusion and the plantar intrusion muscles. The plantar intrusion. There are three plantar intrusion muscles which are located between the metatarsals. These are the metatarsals. So these plantar intrusion are present between the metatarsal. Now this plantar intrusion each arises from a single metatarsal, from the medial side of the metatarsal. We have discussed that there are three plantar intrusion. This is 1, 2 and 3. Arises from the single metatarsal. Look at the picture. Arises from the single metatarsal. Present between the metatarsal but arises from single metatarsals. So arises from medial sides of metatarsal 3 to 5. This is first, second, third, fourth and fifth. So there are three plantar intrusion which arises from the medial side of third to fifth metatarsal. Metatarsal, this is third, fourth and fifth metatarsals. For plantar intrusion, first you have to remember that there are three plantar intrusion which are present between the metatarsals but arises from a single metatarsal and arises from the medial side of the metatarsal, third to fifth. So the first plantar intrusion arises from the medial side of third metatarsal. The second plantar intrusion arises from the medial side of fourth metatarsal, whereas the third plantar intrusion arises from the medial side of fifth metatarsal. So there are three plantar intrusion, first, second, third, present between the metatarsal. Now this first plantar intrusion, it is present between the second and third metatarsal but arises only from the medial side of third metatarsal. The second plantar intrusion present between third and fourth metatarsal but arises from the medial side of fourth metatarsal. This is third plantar intrusion which is present between the metatarsal fourth and fifth, but it arises from the medial side of fifth metatarsal. So all these three plantar intrusion arises from the medial side of metatarsal 3 to 5 and they insert on the medial side of the phalanges. Look at the picture, they insert on the, arises from the medial side of metatarsal and insert on the medial side of the phalanges. Action of the plantar intrusion is that they attack digits 3 to 5, lateral 3 digits and flex the metatarso-phalangeal joints. These plantar intrusion are also innervated by lateral plantar nerve. The second group of muscles which are present in this fourth layer are the dorsal intrusion. हम फोकस किस पे कर रहे थे कि they arise from a single metatarsal. Plantar intrusion, they are present between the metatarsal but they arise from single metatarsal because the dorsal intrusion arises from the metatarsals of both the sides. Clear? Plantar are present between the metatarsal but they arises from a single metatarsal. Dorsal are present between the metatarsal. They are also present between the metatarsal but they arises from the both sides of the metatarsals. So there are four dorsal intrusion muscles. 1, 2, 3, 4. So there are four dorsal intrusion which are located between the metatarsal but each arises from two metatarsals. They arises from sides of metatarsal 1 to 5. For example, this is first dorsal intrusion muscle which arises from the sides of first and second metatarsal. Second one arises from the second and third metatarsal. Third one arises from third and fourth metatarsal. Fourth one arises from fourth and fifth metatarsal. So we will say that they arise from the sides of metatarsals 1 to 5. All the 5 metatarsals are involved to give origin to the dorsal intrusion. Now the first muscle is attached. This is the first dorsal intrusion. The first muscle is attached to the medial side of the proximal phalanx of the second digit. This is the first muscle which inserts on the medial side of the proximal phalanx of second digit. The second to fourth intrusion are attached to the lateral sides of the proximal phalanx of digit 2 to 4. Lateral sides. The action of this muscle is to abduct the digit 2 to 4 inflex the metatarsophalangeal joint, and they are innervated by lateral plantar nerve. So this was all is about the muscles which are present in the sole of foot. Okay, let's revise the muscles which are present in the layers of foot. So this is the first layer. Three muscles are present in the first layer: abductor hallucis, flexor digitorum brevis, and the third one is abductor digititivity. The muscles which are present in the second layer are: this one is quadratus plantae, and lumbricals. Quadratus plantae arises from the calcaneus, insert into the tendon of flexor digitorum longus. Lumbricals arises from the tendons of flexor digitorum longus and inserts on the digits. In the third layer, again three muscles are present. The one is flexor hallucis brevis. The second is adductor hallucis. The second is adductor hallucis, and this third is flexor digitivity. This one is towards the great toe is flexor hallucis brevis, which inserts on the great toe. Then adductor hallucis, again the name indicates, inserts on the great toe. The third is flexor digitivity, which inserts on the little toe. In the fourth layer, two groups of muscles are present. The plantar intrusion, these are the plantar intrusion because they are three in number and arises from single metatarsal, from the medial side of the metatarsal. Then there is the presence of dorsal intrusion, which are present between the metatarsals. These are dorsal intrusion, which are four in number, present between the metatarsal and arises from two metatarsal. The first is inserted on the lateral side. Medial side. This is the first dorsal intrusion, which is inserted on the medial side, whereas the remaining three inserts on the lateral side. Clear? So there are four dorsal intrusion arises from the adjacent metatarsals, but you just have to remember that the first one inserts on the medial side of the second digit, whereas the remaining three inserts on the lateral side of second, third